Welcome to Retrain Your Brain Post-Stroke Part 3. This is Dr. Katrina Banks, physical therapist and owner of Neurologic Optimal Wellness Physical Therapy. Today, we will talk about how the principles of neuroplasticity can be integrated into stroke rehabilitation. So today we're going to talk about a case-based scenario and incorporating the principles of neuroplasticity. So when working with stroke patients, I tend to ask, what exactly are your goals? And is there anything in particular that you want to work on? It is important to involve you, the patient, and allow you to make decisions within your recovery. It's also my duty as a physical therapist to make sure that any goals that you're sharing with me are pretty realistic and you returning back to what you desire. So I'm going to talk about a patient that I saw recently, in the last couple of months. Um, Pretty young. She had a hemorrhagic stroke. We're going to name her Determination because I certainly cannot use real names. Um, so patient Determination, she's a 46-year-old female patient with a hemorrhagic stroke. So she was not compliant with taking her blood pressure medication. So she had high blood pressure, which led to increased pressure of the vessels in the brain. She had a burst, which caused the hemorrhagic stroke. Upon assessment, she presented with right-sided weakness and coordination of the arm and leg, as well as difficulty finding words when speaking. Some functional deficits with utilizing the right arm, standing balance, standing up, walking, and she was pretty fatigued. The patient is fairly young. She's 46. She was a bank teller, but loved to go out to dinner with her husband and go on neighborhood walks for leisure. The patient's primary goal was to be able to walk safely in the community, get back to working, and go out to dinner with her husband. So she came from an inpatient rehab and was on a walker still because her balance wasn't that great. So upon seeing her in the outpatient clinic, I educated her on the principles of neuroplasticity in regards to stroke rehabilitation. Then we began incorporating them into her rehab routine. So we did some baseline therapeutic exercises to address her weakness in the arm and legs. But knowing that the patient was mobile prior and very independent, with the goal of standing and walking safely, I decided to challenge the patient with standing balance activities and walking training. This aligned more with the patient's goals, and we were rewiring connections within the brain to complete this task. I simply could have provided this patient with a seated exercise program, which would have certainly strengthened her legs, but it wasn't functional enough, not as challenging to rewire the brain, and did not align with her goals of standing and walking. So I also had to think about, what does she need to do to be very successful at dinner with her husband. So she has to be able to pick up her glass at the dinner table and be able to bring her glass up to her mouth smoothly. So weakness with hand grip was noted. We worked on exercises to increase hand grip strength, but to make it more functional, I had the patient grasping different size cups, different textures, and various weights, and practice bringing that cup up to her mouth. So I simply could have had her strengthen her hand muscles, which is certainly beneficial, but it would not have been functional enough to cause a rewire of connections in the brain and carrying out a normal task of picking up a glass to have a drink. So patient also expressed the goal of wanting to get back to work. So her job requirement was that she would stand at the counter as a teller at the bank, um, count money, and be able to maneuver that money and hand it to her customers. So incorporating what she does at work, we worked on building her standing tolerance first, and then worked on those fine motor skills and picking up coins with her affected hand, and made sure that cognitively she was intact by counting money correctly. So any task involved in retraining your brain post-stroke should be functional. And I'll repeat that again. Any task involved in retraining your brain post-stroke should be functional. So you're probably wondering, how does the principles of neuroplasticity um, integrate with patient determination? So the patient did well working with me because she used her affected extremities, use it or lose it. She used that right arm. She improved on her movement. It wasn't pretty at first, but she used it and improved it. Her tasks, the tasks that I had her doing were pretty specific tasks, and they were important to her. So that knocks out two principles right there. Specificity matters. So specificity being gripping a cup and bringing to mouth to drink, standing balance activities, walking, utilizing the affected hand to maneuver money to carry out tasks for work. And then it mattered being a big deal for the patient, salience. So going back to the patient's goals of walking, drinking at dinner, and performing job duties. So aligning it back to her goals. She practiced these tasks over and over and over. So repetition matters. Doing these tasks over and over retrains your brain, and having her do it in the clinic and outside of the clinic was very, very beneficial. Having no interference, so working on one task at a time. So in this case, I had the patient work on one task individually. So we worked on standing tolerance, as she has to stand at the bank at, throughout the day. And then moving that and adding a component of utilizing her hand, maneuvering money while standing up is more of that transference principle. So the patient, she's young, she's 46. Her brain she can learn new things, which allows her brain to promote neuroplasticity, more rewiring. And then again, having learned a new task, pushing that patient a bit harder to work harder on that task is beneficial. So it's not your physical therapist being a pest. Like, we honestly want you to really work hard because we know that you can do it. So I hope this was helpful in explaining how the principles of neuroplasticity are incorporated in stroke rehab. Check out video 4 for the framework of recovery, and I hope to see you soon.